now I'm going to hand over to Navina and Varcha, who are going to be moderating and hosting the panel discussion. So just quickly before we start, so the Q&A part of Zoom, as some of you guys have already started to do, you can upvote questions that you'd like to be answered. I mean, given that we do have quite a bit of time, we've got until 12, but it's unlikely that we'll be able to answer every single question. So if you guys could pick the ones that you really want to see be answered, please do upvote them. So yeah, I'll hand over to Navina and Varcha.
Sorry, just very quickly, I think Dr. Zirva's just stepped away from her computer for a second. She'll be back in a second. But if you guys just get started with asking questions for Dr. Ekins, and then when Dr. Zirva's back, we can get her answering questions as well.
Yeah, no, thank you so much for your talk today. It has been really, really insightful and interesting, and the students are dropping in lots and lots of really interesting questions. So one that I think quite a lot of students have is, what are the most important qualities you think a doctor should have?
Oh, okay. There's lots. There's not really a right or wrong answer to this. So if it comes up in an interview, there's not really a wrong answer. But personally, I think communication is probably going to be up there. Whether that's communicating with your patients, their families, your colleagues, and whether it's verbal communication or written communication in the notes, it's really important to have good skills in that area. So that's probably what I'd say is going to be the number one. Teamwork is probably number two. You never really, or Dr. Zirva might disagree with this, because in GP land they have a lot more ownership as such over their patients' care. You tend to have one GP only, and they tend to stay in their GP office for the whole morning. They don't tend to speak to other GPs necessarily during that session, whereas in hospital we're constantly liaising with other members of our team, whether that's other doctors, nurse specialists, for myself in paediatrics, often midwives, all sorts of people, social services and paediatrics, often we're liaising with them as well. So that teamwork side of it's really important. I don't think there's a single patient who I've looked after who I could say that I was solely responsible for giving them all of their care. I always work in a team. And the third one, probably honesty. Everybody is human and makes mistakes, and it's important to be honest about that and face up to it, and tell people about it so that you can resolve things. If you're not being honest with your colleagues about things that have happened, that's not a safe way to practice medicine. And you obviously also need to be honest with your patients. If you tell them, oh, don't worry, everything's going to be fine, and actually you know that there's potentially a serious problem around the corner, that doesn't serve anybody well to do, just to sort of say those sorts of things. So yeah, being honest, I think, is important as well, which kind of loops back around to the communication at the beginning. But yeah, there are loads of qualities that are really important. You could say like leadership skills, you could say motivation and hard work, you could say being able to reflect back on your previous experiences. What else could you have? Manual dexterity. If you're going to be a surgeon or somebody who's doing lots of fine procedures, dexterity is really important. Yeah, there's loads of skills, so there's not really a wrong answer to that one.
Dr. Zirva, what are your thoughts on the most important qualities of a doctor?
Good question. So from what I gathered from what Steph was saying, you could pretty much argue most skills are useful for, I don't know, a single skill that's not useful for being a doctor. It's all about how you frame that skill. And like Steph said, transferable skills, pretty much any skill that is a skill really is probably transferable to medicine, and it's just how you frame it. So I suppose personally for me, I have the really kind of boring ones that I really like. So, you know, you have to be empathetic, you know, you have to genuinely want to listen to your patients and listen to the lives that they lead it might not be exciting medicine and all the kind of pathology and all the disease and stuff, but actually that's really important. You get more information from listening than you do by asking questions. I'm sure all of you would agree on the panel, from all of your experiences so far. If you give that patient a chance to just speak for a minute, you get pretty much the whole consultation there. So kind of listening skills, communication skills, those are really important transferable skills. For a doctor specifically, I think they also look at things like leadership skills. So, you know, they will want to see how you've demonstrated, you know, no one's expecting you to have necessarily been a captain of a team, but all of us will have been a team leader at some point. So whether that's we took initiative to, I don't know, set up a society, or we took initiative to help out with a charity, or even the fact that we just sat down and we took initiative to find our own work experience, like that in itself has leadership skills, rather than someone giving it you on a plate and saying, oh, here you go, have that. Like, they don't want someone where they, you know, they've been handed everything on a plate. They want someone who's actually gone out of their way to try and find the information out themselves, and do all of that. I'm trying to think what else. Organizational skills are definitely useful, because like you've seen with both the presentations, we have a lot to balance on our plates, and you as medical students tomorrow will also have a lot to balance. Like, how are you going to go to all of your lectures and then go to placement and then do all the work afterwards, and also like have time to socialize and have friends and actually have an experience and be part of social clubs? Like, they need to know that you know how important it is to organize your time as well. So I probably just yeah, those three for me, I think.
And you mentioned about leadership as well. So it seems like a really, really important skill to have, and I'm sure through both of your experiences, you've been in positions leading teams before as well. So what role does leadership play in your professions?
Shall I let Steph speak first, because Steph spoke first before?
Yeah.
Oh, okay. You're buying yourself some thinking time. Times that we often take the lead role in hospital medicine is dealing with an emergency. So going back to that second case, I discussed the newborn baby who was born not breathing. That would usually be dealt with by a junior paediatric trainee such as myself, in combination with a midwife. And if between us we were struggling, I could then call for more senior help, but I would be expected to manage that scenario by myself, or not by myself, to lead that scenario with just myself and the midwife to start with. And so leadership skills are particularly important in those sorts of emergencies. However junior you are, there's going to be a time where you're the most senior person there because no one else has arrived yet. And then as people sort of arrive, and you sort of take on that leadership role as they come in, and you sort of utilize their skills. Obviously, as you progress further sort of towards consultancy, leadership becomes more prominent. So on things like ward rounds, you're leading those. At the level I am at the moment, I don't lead a ward round. It's always led by a registrar or a consultant. But I know that I'll be stepping into that role in another few years.
Cool. Shall I share my GP, I suppose, from my GP hat? Although, to be fair, you know, I've been a foundation doctor, I've been an SHO as well in hospital, and that's completely right. Honestly, if you have a title doctor, you will be a leader at some point of some kind of a scenario, whether it's just someone's collapsed in front of me and like, oh goodness, okay, CPR, who starts CPR? Okay, I have to stand at the front. Okay. So but yeah, as you become more senior, the responsibilities and particularly leadership skills become more important. So where I work as a GP, essentially, if there's any problem, I think even if there's an administrative problem, they'll knock on my door and be like, how am I supposed to do this? Or where am I supposed to refer this person to? Or, you know, the patient's called up asking me this, you know, how do I answer this? So you're very much in that position where people feel like they can get their answers from you. Equally, leadership isn't just kind of in the clinical setting. So clinical setting is like either hospital or essentially where patients come. So for example, when I was a GP trainee, I put myself forward as like chair to represent the views of GP trainees in front of kind of the faculty that oversee GP trainee, so that our views are represented, because lots of people have problems on placements, lots of people have problems because of life and everything like that. And actually, you know, as a leader in that, you can essentially take all of that to important people and try and get change made, which, to be honest, as medical students, you will do as well, because you'll be part of those societies. You might be first year, second year, third year rep, talking to the kind of faculty members. If there's a problem with your curriculum, you can do that as well. You can take leadership on all sorts of things. So the sky is your limit, I guess, with leadership when you become a doctor.
Perfect. So the next really popular question that we have is, either through your foundation years or currently, what would you say is some of the biggest challenges you faced as doctors, and how have you sort of overcome these?
Probably, I think early on, a big challenge was dealing with the first few patients who passed away or who had a negative outcome where we couldn't cure the disease that they'd come in with, or we couldn't improve their symptoms significantly, or if things unfortunately weren't treatable at all and they did pass away. The first few times that happens to you, you get in this cycle of, oh, was there anything more I could have done? Blaming yourself, wondering if perhaps if you'd done something differently, they might have survived. I think being in that position of responsibility when you're still very junior, and then having something negative happen, is a challenge for a lot of people. As you have that happen a few more times and you speak to more people about it, you come to realise that obviously everybody does die, and not every single disease is curable. And it might be that, well, whoever the doctor was, the outcome probably would have been the same. And it was an unfortunate circumstance, but it wasn't necessarily something that you did wrong. And so learning to not blame yourself for that sort of thing is important, and discussing that with colleagues is really, really useful. Luckily in paediatrics, it's a very infrequent occurrence, so I've chosen a specialty where I haven't got to deal with it too often. Dr. Zirva probably has quite a few more patients where they passed away, because obviously general practitioners look after everybody. The other challenge that I would say that I think I still struggle with is the work-life balance side of things. So in hospital, the hours are quite long, and you're doing multiple shifts back to back. So on that day in the life, my day starts at 8 a.m, finished at 9 p.m. So it's a 13-hour shift, and you would do 4 of those in a row. So during that time, you're kind of just going between work and sleep, and so the work-life balance is challenging then. But then once you've done that period of 4 really intense days on call, you then have a 3-day weekend. So you do get some time back, and I think dealing with work-life balance is more about time management and reallocating how you spend your time. Junior doctors can only work up to 48 hours a week on average as a maximum. Most contracts are actually more like 40, 42. And an average sort of 9 to 5 job in an office, which is considered to have a fairly good work-life balance, is the 37-hour week. So really, it's not many more hours, it's just that they're all kind of clustered together into these massive long shifts. But you still have the same hours in your week, you just have to redistribute when you do stuff. And I guess the irregularity of shifts mean that if it's something that you want to do recurrent on the same day, same time every week, that's sometimes a bit tricky, because shift work means that your pattern is totally different every week. So I think those are probably the two challenges that I would say.
Great, Steph. I think the only things I probably have to add to that is, so in terms of the work-life balance, I remember as a junior doctor when I was doing all the shifts and everything, I used to get one of the challenges with that was I'd miss like my friends' weddings. I wouldn't be able to go on holiday with like my friends and things like that. So you miss out on a lot of life events just because you're a doctor. And you can try and swap as much as you want. But I remember there was times where literally you were working, you know, probably relatively unsafely, just so you'd be able to get that window to be able to join in with what your friends are doing and things. But you can only do that for so long. The main challenge I've had throughout being a doctor, and probably I didn't see it so much as a medical student, is just dealing with risk and uncertainty. So, you know, in medical school, you're kind of taught a certain amount of conditions, but actually when you become a doctor, people don't present like they do in textbooks. People present very differently, and you do become a bit of an investigator, trying to like find patterns and, you know, can you actually kind of solve the mystery sort of thing. And a lot of the times, and you probably see it more in general practice than you would in hospital medicine, is that there isn't an explanation for a patient's symptoms. And how you explain that to a patient is actually quite challenging. And I used to find that really difficult in the beginning, but now I suppose I've done it so much, I'm a lot more confident doing it. So, but definitely in my earlier years, the kind of dealing with risk. So, you know, is it okay for me to send this patient home? Am I missing anything? Am I supposed to do any more investigations? Will I know that they'll be okay when they go home? Those sorts of things. So they're definitely the challenges probably that I've faced.
Thank you for sharing. Now, obviously on the other side, what would you say are the best bits of being a doctor? Dr. Ekins, do you want to start off with this one?
Yeah, where do I start? There's so many. I think really it all comes down to the satisfaction that you get from work, whether that's the sort of the cliche, the rewarding, oh, I help make somebody better, or had some sort of positive impact, or whether it's the satisfaction of working in a team sort of for the same common goal. I really enjoy that. Sort of starting the day with a long list of jobs that need to be done, and then working as a team to get all of those things done and sort of ticking them off during the day, and that satisfaction of all working to have the same goal of making as much positive impact to as many people as possible along this road of sort of investigating, diagnosing, treating different diseases and things. I find really probably is the best thing about the job. The other thing I would say, Dr. Zirva and I are both sort of beyond this point now, but when you first go into medicine, there are so many different opportunities that you sort of for different specialties that you don't even realise. So there are about 50 different specialties, 50. And I don't think I realised when I first applied to medical school there were so many different career pathways that I could take after I graduated. Even once you've chosen a specialty, within that you can subspecialise within a particular area of interest, and you can diversify your work further, as all of Dr. Zirva's extracurriculars have shown, sort of working with universities and charities and all sorts of other groups. So it's a very diverse career. You can make it wherever you want it to be.
I think the only thing I would add to that is that there are very few professions where you are pretty selfless. So yes, you work really hard to become a doctor at the end, but actually what you do, it doesn't just help a person, it helps a family, it helps a community. These things, you know, some of your patients could be, I don't know, a police officer, and if they've got a health problem and you've helped that, you've helped lots of people because you've got another person who's still kind of working and able to do their job. I feel like I've learned a lot about life by becoming a doctor. I know that sounds silly, but it's like I would never have met the amount of people that I would have done if I hadn't been a doctor. Like, you meet people and you hear stories about the way people live, and I'm like, I can't believe people live like that. Like, I was so sheltered. And I think, like, if I ever told my friends who are not doctors and they're part of other professions the way some people live lives, like they'd be astonished. And I feel like I'm so much more grounded because I think I know how the world works a bit better, as odd as that sounds. But those are definitely the other things I'd add to that.
Yeah. And of course, being part of a profession that's quite rewarding, you've had so many positive experiences with it. A really important question for that students get asked at interviews, but also a really important question students should ask themselves is, why become a doctor? Why not a nurse or a paramedic? So could you maybe share sort of your reasons for becoming a doctor? Could you give a little bit of insight into that? Dr. Zirva, would you like to answer first this time around?
Going to put me on the spot now. So it is a really important question, and it was an important question when I applied, and it's even more of an important question now. And I suppose the argument for that question is, you know, when I applied to medicine, there was a clear distinguishment between being a doctor, being a nurse, being a pharmacist, etc. Whereas now there seems to be a lot of overlap in roles. So nurses can become nurse practitioners, which allow them to prescribe, see patients, have their own clinics. You know, I have nurse practitioners that work with me and deal with like minor health problems. They don't need to come and see me and ask me for any questions. There are pharmacists that can do the same. So it's something that people really have to sit down and think about. When I was applying for medicine, I suppose the role of a doctor was so clear cut in comparison to the other roles. That answer for me was much easier. So I wanted something where there was more leadership, kind of more of an assumed leadership. So being a doctor, like we've already discussed, you are kind of assumed to be the leader in whatever kind of a position, whether it's on a ward round or whether you're in an emergency. You are the person with the most senior amount of knowledge, usually at that point in time. I think nowadays it's probably, you know, looking at the exact differences between like being a doctor and all of the other roles. So I'm sure Dr. Steph will probably have a better answer for this, but for me, I felt like there was a big difference in being a doctor and other sort of specialities. And from when I have worked with nurses, there's a limited kind of scope of practice that they have. So for example, they'll be able to do something in particular, but as a doctor, I suppose you need to have lots of different skills and lots of things about that. I guess as a pharmacist, if you want to progress, you have to do extra qualifications and things like that as well. So I'll hand over to Dr. Steph.
Yeah, I'd echo all of those things as well. I think because I was sort of someone suggested, well, my granddad suggested to me being a doctor quite early on in life when I was 12. I hadn't really thought about being a nurse or being a paramedic, and this idea in my mind just kind of grew from a seed into, well, whatever this is now. And to be honest, I didn't really consider many other careers, to be honest. I remember a conversation with my parents when I was sort of in year 12 and I was sort of getting ready to apply to university, and my parents said, oh, you can only apply to full medical schools, you've got that fifth choice on your UCAS form, what are you going to put in it? You need a backup option. And I said, well, I don't want a backup option. I want to do medicine. If I don't get in, I'll just reapply again next year. Even if I got into my backup option and not into medicine, I wouldn't take the backup anyway, because I want to be a doctor. And yeah, I think I hadn't really considered some of those other careers. Now that I've worked alongside people from those other health professions, I could actually see myself working in quite a few of them. And I think I was just so focused on being a doctor, I just didn't really consider those other things, to be honest, which is not the answer you should give in an interview, but that's the truth for me. Like as I said earlier, I work quite closely with nurses and midwives, and I could see myself doing each of those things. In my voluntary work with St John Ambulance, I work a lot with paramedics. I could see myself doing that too. So yeah, if I hadn't got into medicine and somebody had actually said, what about all these other health careers, I might have gone down that route. But I thought at the time that the obvious alternative for your fifth choice on the UCAS form would be biomedical science or something research based, which wasn't my thing at all. I hadn't really thought about the other jobs in healthcare, which was really stupid and naive. But yeah, there are lots of other opportunities out there, and the differences between other healthcare professions and doctors is being narrowed. So nurses are starting, well, some nurses are starting to prescribe medications, and sort of more advanced nurse practitioners are taking on more roles that doctors would traditionally do. So they're assessing patients and diagnosing diseases and treating them and things. So there's not a huge amount of difference perhaps in the day-to-day life of an advanced nurse practitioner to a junior doctor. In some ways. In my work in the neonatal department, we have advanced neonatal nurse practitioners, and they work on the same rota as the doctors. They're rotated for the same shifts. They do the exact same things. That's where the ceiling of their career progression sort of ends, though. Whereas the junior doctors can go on to become consultants later. But that's sort of one of the only real differences that I see between the nurse practitioners and ourselves in neonates.
Perfect. Thanks, Dr. Zirva and Dr. Ekins. I think it's really helpful for our students to hear sort of that rationale behind. I think another question we have is, obviously you've mentioned, both of you, that there have been differences in the past, how nurse practitioners were sort of defined and doctors as well. What would you say your fields would look like in the next, say, 20 to 30 years? Should we start with Dr. Zirva on this one?
So in 20 to 30 years time, I hope I'm retired and not working. I'm joking. But I think in terms of the role of a GP, so I'll give you just an example of how the role has evolved since I started as a medical student. So when I started as a medical student, the only person that was consulting with patients and doing, the kind of doctor consultation was a doctor. So it was a GP. So we saw things from really, really minor things like a urine infection, to really complicated things like someone who's dying of cancer or something. Now, in that time, so I'm a little bit more vintage than you guys here, but if it's been like what, 13, 14 years. Now I see a lot. I would be lucky if I saw a urine infection in a day or a chest infection. I would do anything to see that, because for me that's like bread and butter. I know, I know that, I know the management of that inside out. I know how to deal with that. But what I'm seeing more of is the complex stuff. So we know that we are in an aging population. People are getting older. People are having more and more health problems, and the COVID pandemic has thrown in so many other issues. So financial issues, mental health issues. So the bulk of my work has gone from, like a real mixture of, you'll have some easy things in between, and you'll have some really difficult things that make you really need to use your brain for it, to pretty much the whole day is just like something complicated and something that you have to be on the spot ready to deal with. And to be honest, I don't see that changing. I see that difference becoming even more. And we've got so many more new allied healthcare professionals joining. So physician associates is like, it's a thing that's been around for a long time in places like America, but in the UK, there are pockets of areas where they've got lots of physician associates, but they are pushing it because there's just not enough GPs. There's not enough doctors, but there's definitely not enough GPs. So that kind of gap needs to be filled in by someone. So what they're trying to do is the stuff that's a bit easier, where you can train someone else to do it, have them do that. So then at least the work that you're doing as a GP, you're dealing with more complicated patients that you probably, at the end of the day, like I've got specialists I can ask questions to, but beyond that, we haven't really got anybody else. So I would definitely say that will continue. And yeah, there's so many changes happening. I'd bore you with the amount of changes that we're seeing all the time, but that's probably where I see things in the next 20, 30 years, I think.
Great. And Dr. Ekins, how about in the field of pediatrics?
I think the two biggest things that I would hope to see happen in pediatrics, and I hope it's not an unrealistic pipe dream for 20 or 30 years, would be personalised medicine becoming more common. So that's basically where sort of using genetic information, we can personalise treatments a bit more to individuals so they work better. There are lots of genetic diseases that we see in paediatrics. Sometimes, well, you'd see more of those in paediatrics than you would in adult medicine, partly because some of those genetic diseases aren't survivable beyond childhood, and partly because most of the diagnostics is done during childhood when that child is first born and they're growing up, and by the time they get to adulthood, the diagnosis and treatment is already, well, there isn't really a treatment if it's genetic at the moment, but the diagnosis has already happened, and so they don't tend to perhaps be as involved in adult medical specialties as they are within paediatrics. So I'd hope to see that sort of genetic therapies would improve. And the other thing, the other big thing that we see in neonates, which is the department I'm in at the moment, is preterm babies, and there's a lot of work at the moment to develop an artificial womb or an artificial placenta, so that babies who are born preterm, instead of being put in a plastic incubator and as trying to use ventilators and things to keep them alive until they've grown to a full term kind of size, we could potentially in the future use some sort of artificial womb or placenta to give the baby the environment that they need to really thrive. I think that would improve outcomes a lot. So yeah, I would like to see that happen. They've been researching that for years and years and years, so I don't know if it will ever come to fruition, but I really hope so.
Yeah, it's really, really interesting to hear how technology and also the kind of diseases we see in society are changing. And so what we will do as future doctors, hopefully, and what our aspiring medics will do as future doctors might be completely different to what we're seeing now. But I think one thing that definitely is a challenge in medicine and something that will stay and stick around is things that have quite high impacts emotionally on doctors. So both of you have been in quite a lot of emergency scenarios, and I can only imagine they must be taxing at times. So how do you deal with the emotional impact of this during your work? Dr. Ekins, would you like to go first on this?
Yeah, can do. I think talking to your colleagues is probably the number one key for me. So after something that's emotionally impactful at work has happened, if it's safe to do so, obviously you don't want to leave the patient in the middle of the emergency just because things have perhaps got a little bit too much. You can't leave them with no doctors at all. Once it's safe to do so, stepping away from that clinical area and having a cup of tea with a colleague, going through what happened, and sort of bouncing ideas off of them. A lot of those sad, negative, emotional things I find either come from could I have done something different that would have helped the patient more, and discussing then with a colleague the fact that yes, we did do everything we could and there was nothing more that anybody else could have done, I find useful to help me to process things. And the other thing that I think a lot of people find emotionally impactful is relating something that they've seen at work with a patient to something in their own life. Working in paediatrics, so I haven't got children at the moment, but I can imagine that when I do have children, hopefully in the future, that seeing a poorly baby or child in front of me would be more upsetting potentially then. I know that, so when I was a medical student, my granddad passed away, and about a month later, I had a placement in a hospice, which I found really, really tough because that was the hospice that he died in. And so when things link back to your personal life, I think that gets a bit tricky, but talking to your colleagues and yeah, having time off work if you need it. It's okay to take a step back if things get a bit too much.
Yeah, I'd probably just echo those points, to be fair. So I could never do pediatrics because I struggle seeing sick children. I know in my capacity as a GP, I have to see them, but like I essentially just, I don't have to deal with them when they're so sick, because I would call the ambulance or something. But I wouldn't be able to do a job like pediatrics because I think there would be a heightened emotional impact for me. But to be fair, it's similar from my end. So we've had things like debriefs whenever we've had difficult situations. So sometimes, for example, like I think in my first year of working, there was a really, really difficult CPR where it was a young man. So you could imagine him being like, I don't know, your older brother or something. And he had a heart attack and he died. And the whole team was so shook by it because we spent ages with him. We spent so much time with him. We gave him every drug in the book that we could to try and help him. And it didn't. And so we were all very much those sorts of questions. Could we have done anything more? Did we try hard enough? Was there anything else that we could have done? You know, you need to sit down and have that conversation, ideally with the rest of the team, but someone who's more senior, who's more experienced, because the repercussions can be quite a lot. So I know people who've not had those debriefs and they've had to be on long-term sick. Some people develop mental health problems. So it's really important to get that support. And I guess have that insight. So a lot of people are quite fearful of getting support after those sorts of events, but thankfully they're very, very like they don't happen often. I think you'd be once every kind of 6 or 8 weeks that you'd have something like that, but maybe even less than that. So it's really important to have a team that supports each other through difficulties, because one person might find something challenging, the other person might not, and it's knowing kind of people's strengths and weaknesses and working with that, I think.
Thank you for that. I think it's really helpful to our students joining today and also to us, in fact, as current medical students. I think another question that we have is, how do you stay motivated for the long run? So obviously medicine's so long and specialty training is also even longer. How do you particularly keep yourself going? If Dr. Zirva, would you like to take this one first?
Yeah, sure. So that's a good question, because not everybody likes learning. I know lots of my friends who aren't medics, they were like, I'm done with my, once their degree was done, their 3-year degree, they were like, I'm done with learning now, I really don't want to do any more learning. So I think when you commit to a specialty like medicine, most people that will commit to it are people that like kind of lifelong learning. And me as a GP, I will still learn every single year. I'll go on update courses to make sure I've got the most up-to-date information, evidence-based medicine, etc. Motivation kind of varies. So you will go through times where it's a bit more challenging. So I had a very difficult job in A&E, and that really changed my perspective on what I wanted to do in my life. And I used to think like, why would I want to work for a specialty or work for a career or a profession where I feel so rubbish about myself and everything else, despite doing my best? So people do have setbacks like that. And I know people that have had jobs, and because of those jobs or experiences, they actually left the profession. So, what helps me is kind of regularly checking in with myself and making sure that I'm okay. I've got things that I do outside of medicine, because you can burn out by just being a doctor all the time. You need to have hobbies, you need to have a life outside of your career, and they definitely keep you motivated because you seem to have more perspective then. But I really enjoy learning, and I enjoy learning about kind of technology and advances in medicine and things. So that definitely motivates me. And I suppose probably even more important than that is the people that you're helping. So yes, you'll have days where people will swear at you on the phone, or people will, complain and things. But actually, majority of patients really like you, and you've changed their lives. You've helped them live their lives, and you've helped them find, I don't know, whatever they needed to find, and give them a better quality of life and things. So that in itself for me is so important, that I can, what I think is quite small is making a big difference to people. So that most certainly keeps me motivated.
I would agree. I think the other thing that I sometimes think about when people say, oh gosh, medicine is such a long career pathway, etc. Yes, it's a little bit longer at university, but then after you've graduated, regardless of what job you go into, you start off sort of at the bottom of the pile, as it were, and then you work up through a series of promotions to get to the peak of your career. It's that exact same thing in medicine. It just follows a very structured career pathway. Where every year you're basically guaranteed a mini promotion as long as you've met the requirements for completing that year, which is all sort of done on an electronic portfolio, basically. As long as you've done all of those requirements, you basically are guaranteed a mini promotion every year until you finish your specialty training. And so, yeah, the whole time you're in a job. So the fact that you're still in training when you're in your into your 30s. Most people in other professions haven't reached their career peak by that age either. So I don't really see it as anything that is particularly a longer career pathway than anything else, because every job requires that progression as you go from sort of starting in your 20s sort of all the way through until you retire whenever, in your 60s probably. So yeah, I'm not sure that I buy into the concept that it needs more motivation necessarily, apart from the fact that the challenges of the job and needing to do things outside of work or outside of work time, like provision for your postgraduate exams, that perhaps is a bit of a block. But apart from those things, I think once you're sort of on that career pathway, if you're enjoying it, it's the same as any career progression.
Yeah, no, that's really good to hear, because I think especially during medical school and during COVID, even more so, it's easy to kind of lose track of where you're going. It does feel quite long, so it's reassuring to hear that afterwards it does feel a bit better. It doesn't feel as difficult to stay motivated. A really nice question we've got from our students is, what advice would you give to someone shadowing a GP, but also applicable to hospitals as well? What should they be looking out for, and how can they make the most of it and get stuck in with it?
I guess if you talk about GP first, then I'll give that answer a shot. So to be honest, there are different types of GP surgeries that you might end up in. So some of them are really experienced in having people on work experiences, and they will have a program for you. So that's really nice, because they know exactly kind of what things you need to have experience in, or things that you need to see to be able to help for your personal statement and your interviews and things. Other placements may never have had anyone doing any work experience before. And so then you would probably have to do more to make sure that you get the most out of that. So I'll probably talk about the latter, because the first you wouldn't really need to think too much about what to do. I suppose the idea of general practice specifically, and then maybe Steph can cover like hospital medicine, is in general practice, being able to shadow what everybody does and have a like clear understanding of the different roles that there are. It's not, you don't need to like memorize it or kind of, it's just more having an awareness and understanding that there are different roles in general practice. And I guess understanding how general practice fits in with the rest of the NHS system, because the NHS system is changing all the time. Every area, like from when I started medical school to now, they've seen like hundreds of changes, and it's actually really difficult to keep up, but just having a general understanding of where it fits in. You know, if there are any special services that they provide. So for example, where I work, they do some implant insertions and things like that. So if they do any minor surgery, any minor ops, actually just watching that and seeing how kind of diverse the career of a GP, or, you know, all the other things that a general practice may do. So some GP surgeries have other clinics that are going on as well, like a special skin clinic. So it's just trying to get as much exposure as possible and just asking them lots of questions. And like I said, paying attention to not just what's happening, but the impact of what's happening. So, you know, those cases where, for example, that person who's got anxiety and depression, you know, if she's not got enough money to feed her children, that's a big deal. You know, is there anything else that you can do to try and help with that? Just being aware that like the role of the GP setting is more than just, you know, doctor, nurse, receptionist. That there's a lot more that's going on in the background. But I'll hand over to Dr. Steph now.
Yeah, it's similar sorts of things in hospital. So trying to observe some interactions with patients, whether that's between a doctor and a patient or a nurse and a patient, trying to see some of those consultations and get a broad overview of some of the things that that you might see and what that sort of typical day in the life would actually be. I think so. Well, we've had work experience students come to us before, and I think as a work experience student, introducing yourself to the whole team at the beginning of the day and asking them to come and grab you if they're going to do something interesting or exciting is probably a good approach. as a medical student, I would actually advise, well, once you've got your sort of sign-offs and bits and bobs done, I would actually just attach yourself to one person, like one junior for the whole day, so that you get to see what their whole day looks like, rather than just jumping between the most exciting bits of different people's day. So I would take a slightly different approach if you're a medical student trying to understand what life as an F1 is going to be like, versus someone who only has a week in a hospital ever as a work experience student. That's your whole placement, and you're trying to get the most out of that time. Probably, flitting between different members of staff is probably going to be the best approach to see as many things as possible. And then after each patient consultation, once the patient has left the room, then reflecting on that and talking to the member of staff that you've been shadowing, I think is useful. So asking them why they did what they did, and trying to understand a little bit of the, you don't need to understand the medicine and the science behind things at this stage, but you can perhaps understand some of the skills that they use and how you approach different problems in the NHS. And then going back to what Dr. Zirva said about sort of not seeing just GPs as sort of just the doctor, nurse, receptionist, and seeing how the whole structure works behind that within hospitals as well as a much wider structure. And so perhaps sitting down with somebody and speaking to them about that might be useful as well. Yeah.
Perfect. Thank you so much. I think we're a little bit short on time, so we'll just sum things up with one final question. And this is, what advice would the both of you give to aspiring medics to become good doctors? So, Dr. Zirva, do you wanna just start with this?
Good question. Repeat that for me again, sorry. I need to try and just make sure I frame my answer.
No worries. So the question is, what advice would you give to aspiring medics to become good doctors?
Okay. So I would say have good intentions. So, go into medicine with good intentions. Don't go into medicine thinking you're going to become a rich, person who's earning lots of money, not doing very much work, because that doesn't happen in medicine. Some people who are doctors become big business people. That's a separate story in itself. But actually, majority of doctors, we work quite hard. We work very long hours. We have to balance our kind of work and our life as well. So go in with good intentions. Second thing is just be reflective. So if you are naturally a reflective person, this skill will come a lot easier to you. But learn from things that have happened. So don't let those things kind of hold you back. So if you've got something that's kind of negative that's happened and it makes you feel quite down, spend time reflecting on it with somebody so you can learn from it, because that's a key skill, I suppose, being a doctor, being a medical student. When you've seen something that's difficult, what can you learn from it? What can you take on forwards? Because, medicine, it's not an easy career. You will see a lot of things that will set you back, but actually just, having insight, learning about it really helps. And the last one I'd probably say is just self-awareness. So know what your own kind of limits are, know what works for you, what doesn't work for you, because even those things will tell you whether you're suitable enough to apply for a career like medicine. It might be that from the outset, actually medicine sounds like an amazing career, but when you look at yourself in that kind of role, maybe it's not the right one, and that's okay. There's lots of careers out there. So but yeah, as a doctor, I think those things are definitely really important. A bit fluffy, but yeah, quite important.
Yeah, I think there are, you can separate the things that make a good doctor into sort of two basic branches. So one is all the science, medical information. You need to know what you're talking about. You need to be competent in those skills. And then the other one is the being a good person, looking after the patient well, communicating with them, building a good rapport, just being a nice person, basically. And I think you need a mixture of both of those things. So on the science medical side, I think a lot of, and well, I certainly felt this way, and I think a lot of other medical students did as well, and potentially still do. I was sort of the philosophy of learning information in medical schools to pass exams, rather than sort of knowing, oh, this comes up in in exams a lot. It's a really common topic. I'll learn this from really well. Oh, this one hasn't come up for years and years. I won't revise this one as heavily. But actually, patients come in with all of these diseases, and you need to know you need to know about them all. You're not learning medicine to pass an exam. You're learning medicine to treat patients. And if your patient comes in with something that you've not bothered to learn about in as much detail, or because it doesn't come up in exams too often, you come a bit unstuck. So I think really having that good grounding in medicine is important. Even if you think you know what specialty you want to go into, you should still obviously pay attention to the other ones. I found that because I knew I wanted to do pediatrics quite early on, I perhaps wasn't quite so, I don't know, interested in learning about some of the other specialties, but they do all interlink. So yeah, that would be one piece of advice about actually learning medicine. Don't just learn it for exams, learn it for your patients, because one day that bit of information might be something that is between your patient surviving or not, potentially. I don't want to sound dramatic, but potentially it could be. And then the other side of things is all of the sort of more fluffy stuff as such, all of those sort of human skills. And I think listening to your patient is probably the one I would say is particularly important to being a good doctor. Patients will give you so many clues to what's wrong with them and what their diagnosis is from what they say. I was once told by somebody that 80% of your diagnosis comes from the history, 15% of your diagnosis comes from the examination, and only 5% comes from results of blood tests and scans. And so talking to your patient, asking them the right questions and listening to what they say, I think is probably the most important part of that. But yeah, being able to communicate things with them, building a rapport with them. So when you come to deliver bad news, that you're a nice friendly face, basically, and approaching that in a human way.
Right, all right then. I think we're going to wrap up there because we're going to all have an hour-long lunch break and then come back for some clinical scenarios in the afternoon. But I just wanted to say, like, Dr. Ekins, Dr. Zirva, thank you so much. We really appreciate you guys coming along to talk to all of the students today. And your insights have been absolutely fantastic. I think all of us as well on the team as medical students ourselves learned a lot. So yeah, a massive thank you. All the students, please make sure to go and follow both of Dr. Zirva and Dr. Ekins on Instagram, posting some really great content on there. And I'm sure they'd be happy to accept messages.